Hi, everybody. So, my patient asked me, Doc, why are you looking at my nails? I washed my hands. And I replied, I am glad to know that you washed your hands, but as a rheumatologist, I am not looking at cleanliness. I am looking at other things. Well, and those things can tell me what's going on in your body. So let me tell you 5 things that your rheumatologist may be looking at when they're examining your joints and nails, specifically nails, so that you can actually look at them when you're admiring your own nails. Okay, so my name is Dr. Arinola Dada, and I help people with joint pain become pain-free so that they can live active lives. So let's do these 5 things, right? Okay, first thing is, are your nails shaped like spoons? And so no, you did not mishear me. Spoons like the utensil spoons, okay? So your nails can look like spoons if you are iron deficient, for instance, or if you have autoimmune diseases. So while you're looking at the nails, that's what your doctor is looking at and saying, if your nails are kind of shaped more like spoons, then perhaps you have an autoimmune disease or iron deficiency, right? And so tests may be done to kind of further look into that. Number 2, do you have funky blood vessels at the base of your nail, so at the nail bed? So typically the blood vessels are really tiny and really not that obvious, right? But if they are malformed, those blood vessels are known as capillaries, and if they are malformed, then it could suggest that one is dealing with an autoimmune disease. The next thing, number 3, is the nail lifting from the nail bed. And when the nail lifts, then the nail actually starts to look white. Of course, the first thing that comes to mind is, well, was there trauma? But actually, in cases where it's not due to trauma, and we love funky words in medicine, so this is called onycholysis. But when it's not due to trauma, it can be due to something like psoriasis or even Raynaud's. Number 4, nail pitting. Best thing to describe nail pitting, somebody grabbed a bunch of office pins and went chop, 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 and then you have all these pits on your nails. So nail pitting can also happen in people who have psoriasis, especially when they're prone to a psoriatic arthritis, which is an arthritis that happens in people with psoriasis, and yes, it's an autoimmune disease. Okay, and then finally, number 5, the DIP joint. So it's not really the nail, but it's the closest joint that you have to the nail. So these are the DIP joints, and in most people, when they get swollen or inflamed, it's actually due to osteoarthritis. Can happen in psoriatic arthritis, but most of the time it's due to osteoarthritis. So while admiring our nails, it's important for us to kind of watch for these symptoms. And if you notice anything, just give your doc a heads up. Say, hey, I heard this Dr. Dada talking about, spooned nails, blood vessels, nail pitting, nail lifting, pain around the DIP joints, and just give your doctor the heads up so that they can do what's best for you. So my name is Dr. Arinola Dada. I am a rheumatologist in the greater Seattle area. Contact us at overlakearthritis.com if you need our help. Otherwise, if you know anyone who you think may benefit from listening to this video, please send it to them. Have a wonderful 2023, everyone. Bye for now.